My name is Ilaria Potukolonkolia from Samburu County. I'm a co-founder and a director of a young organization called Samburu Arms of Hope.
My name is Eunice Lepario from Baringo County, CEO of Baringo Women and Youth Organization.
My name is Evelyn Pret. I work with the Center for Indigenous Child Rights. I'm the founder and executive director. I'm from West Pokot community.
My name is Margaret Super, the Executive Director of Pastoralist Support Initiative, which is based in Marsabit County.
My name is Jacinta Silakan, Director Sangida Foundation. It is an organization that champions for the rights of women and children among the pastoralist communities.
The NAAPU Fund, we organized a football tournament that brought together girls and boys as a way of mentoring them and fighting harmful cultural practices. Such an activity helped boost the girls' self-esteem and confidence. This was very important since girls became aware of their environment and themselves and were able to speak out. Such a tournament allowed us to challenge stereotypes like FGM, early girl child marriage, and school dropout, and gender-based violence as the cases that occurs in our places. During the COVID-19 pandemic, the tournament kept the youth occupied, and both physically and health-wise. Schools were closed, and we saw cases of early pregnancy all through the country during that time, are even forced to engage in sexual activities to get the money to buy the sanitary towels.
We were able to visit 2 wards, that's Rio Ward and Como. In Rio Ward, we took Nakwijit and also part of Chepkobe. And from the data, we found out that there are so many cases of gender-based violence in West Pokot, majorly cases of rape, majorly cases of domestic beatings, of domestic violence. We also found out the issues of FGM is very high. Issues of child marriages or early marriages are very high. Defilement cases are also there. And from that, we went to mobilize the community, to sensitize the community on effects of gender-based violence, and also they should be reporting, to sensitize them, they should be reporting these cases. There are so many unreported cases of gender-based violence in the villages, especially with the indigenous women and girls.
We were able to conduct various activities to implement the project. That was gender-based violence. Some of the gender-based violence were FGM, early marriages, wife battery, beating, and so many others. And some of the things that we found out when we did all the activities was that gender-based violence is rampant in Samburu County. And it is very sad because we found out some of the major effects of gender-based violence from our case that really got us was the effects of beating.
I'm one of the beneficiaries of NAAPU grant, and we did a baseline survey within Ilchams ward and Mugutani ward to find out the extent of gender-based violence. We were able to rescue one lady which was tortured and which was the rights of the lady was violated, and we were able to report the case in Kabarnet, and we were able to get a lawyer for her, and now the case is running. I recommend more sensitization on gender-based violence so that the victims or the women, the youths and the children, they will know where to go and report, they will know their rights, they will know what to do when we are being violated. Secondly, I recommend that we need services within. If we can get a gender desk within our chief's office.
What we did with this fund was we did a survey on GBV among women and girls with disabilities. Some of the challenges that we found while doing this survey was, number one, most women with disability who had gone through GBV were not willing so much to talk about it. And it took us a bit longer time for us to have the women talk about it. they never went to the hospital. The terrains were very far and diverse, so we took a lot of time moving from one place to another to get to the women. We went to the police station and there were no records that were there that the women had reported. And even in the hospital, I think we got like less than 10 women who had gone to report. So we did a validation. And this validation, we brought all stakeholders together. We brought the women, we brought the police, we brought the health department, and all stakeholders. And we came and listened to this validation report. And the recommendations that came out of it was we needed a strong, vibrant GBV task force in Laikipia North, which a woman with disability was to sit in it. Number two, the women were in need, who should be trained more on GBV, the reporting, and all the channels and mechanisms. The other thing was the police station. We didn't have any female policewoman there, so there was also a recommendation to have a gender desk at the police station. And the other thing that we recommended was to have GBV scouts in the villages, so that the women knew that there are some women who are ready, just in case they had any gender GBV, then they can report to the women. And those women will escort them either to the hospital or to the police station. Another recommendation is there's a need for psychosocial support, especially for the women who have gone through GBV, and an establishment of a trauma center where the women will go there for counseling, for trauma therapy, until they are ready to heal. Thank you.